Hello,
Thank you.
Dr. Syed. Welcome to SQ TV.
Thank you. Thank you.
So, if you can please talk about the causes of piles or hemorrhoids. So, what are the causes that finally results in this problem?
First of all, we have to know about piles. What are the piles?
Hmm.
Piles, also called as hemorrhoids. They are uh, large vessels present at the anus region. Whenever these vessels prolapse and causes any other symptoms like bleeding, pain, that causes piles, also called as hemorrhoids. There are many reasons for hemorrhoids, mainly low intake of fiber intake, low intake of water quantity, little excess straining while defecation, sitting for long hours, traveling for long hours, basic causes for hemorrhoids. There are
Hmm.
many other causes like chronic diarrhea and pregnancy,
Okay.
in some cases like IBS, IBD, ulcerative colitis. There are many other causes for hemorrhoids.
Can hemorrhoids be, can problems like hemorrhoids be genetic also? And can also these pass into other generations?
Hemorrhoid conditions, whatever the symptoms present in the hemorrhoid, same symptoms may present in other anorectal diseases. So there are many other anorectal conditions like piles, fissure, pilonidal sinus, and rectal prolapse, many other conditions. In all these anorectal conditions, same symptoms may present. Those symptoms present in the piles. Whenever you are having any anorectal problem like pain, bleeding, itching sensation around anal region, any inflammation or swelling around the anal region, every time need not to confirm it as hemorrhoid.
So, doctor, like I was asking you, what conditions mimic hemorrhoids, and can problems like hemorrhoids be genetic and pass to another generation? If you can also please clear that confusion.
Yes. So basically, any anorectal conditions like any piles, fissure, fistula, even pilonidal sinus, even rectal prolapse. These are the
Hmm.
conditions, and in all these conditions, same symptoms may present. Like if you are suffering with piles, there may be bleeding per annum. If you are suffering with fissure in ano, there may be bleeding, bleeding from anus regions, and even in fistula, you can have like bleeding for annum, and even piles. Your pain is main symptom. Same condition may present in fissure in ano and fistula in ano. So there
Hmm.
are many anorectal conditions that may mimic as piles or hemorrhoids. So if you are suffering with any anorectal problems like especially bleeding for annum, bleeding
Hmm.
from anus, that means while you are going for stools, if you are suffering with bleeding, if you are presenting with bleeding in stool, if you are suffering with pain, if you are suffering with any anal discharges, even if you are suffering with itching sensation, so
Hmm.
every time need not to confirm it as piles. You must
Okay.
consult a specialist to uh, proper diagnosis. So there are many anorectal conditions that mimic as piles.
Yeah, but doctor, also, what are the early signals or symptoms of hemorrhoids or piles, so that if people come to know that these are the signs or signals, and then is there a way to also prevent it uh, before it takes a major action?
Definitely, we can prevent piles. So,
Okay.
basic first main basic symptom is constipation. That means change in bowel habits. If you are
Okay.
suffering with constipation, or if you are suffering with diarrhea, if you are suffering with any gastro problem, like if you are suffering with bloating, if you are suffering with
Hmm.
indigestion, that may
Hmm.
they are the pre symptoms before
Okay.
you are going to convert into piles or constipation. So these are the main
Hmm.
symptoms. Whenever you are going to um, suffer with piles, and
Okay.
even pain around the anal region and itching,
Hmm.
especially itching sensation around anal region, and even
Okay.
wetness around anal region. These are the symptoms
Okay.
uh, before piles we can present. Patient may present with these symptoms.
Okay. So you're saying that like constipation is one of the biggest reason for piles or hemorrhoids to happen. So, like we talked about prevention, before take some major action. So, doctor, I would like to know from you, how can we prevent it by including fibers in our food and by including a lot of water intake? So, what else can we do to avoid these and prevent it?
So basically, to prevent piles or constipation, you three things very important. First of all, a diet.
Mm-hmm.
Second, physical activity. Okay. Third one, proper hydration. These are the three things which we have
Mm-hmm.
to, and even sleep. These are the four conditions. Four things you have to keep in your mind. Especially in diet, you have to take a proper quantity of fiber intake, and you need to avoid excess masala, excess spices, even dried food items, even refrigerated food, cold food,
Mm-hmm.
and irregular diet habits like midnight biryanis, like these are the things. And even cool drinks, like these are the things you must avoid. Irregular diet habits like skipping meals, breakfast,
Okay.
lunch, dinner. These are the things in diet you need to take care. Then second, most very important thing is uh, proper water intake. Proper water intake is very important. Why? Because if you take proper water, then proper digestion of your food may occur. That
Mm-hmm.
ultimately leads to proper formation of the stool. That ultimately lead to proper stool formation. Then there is no strain on anal cushions. That
Mm-hmm.
ultimately leads to proper stools, like proper stool may occur, and it won't lead to any other anorectal conditions. Third one is physical activity. Basic physical activity like exercises, proper exercises. You need to avoid long hours sitting in one place without any movement, and you need
Mm-hmm.
to avoid straining while defecation, and you need to avoid long hours traveling, and especially two wheelers in uneven roads.
Mm-hmm.
These are the things causes minor trauma over the anal region that ultimately leads to piles or hemorrhoids.
Doctor, is there also, is there a problem with drinking too many cups of coffee or tea if you're going through such problems?
Yes, yes, definitely. Whenever you are taking excess tea or coffee, that ultimately leads to hampering of your digestive system.
Okay.
Like enzymes, whatever present in our intestine or in our
Mm-hmm.
stomach, acidity of those enzymes may decrease, and it leads to indigestion.
Mm-hmm.
Whenever indigestion occurs, bowel movements may decrease. That ultimately
Mm-hmm.
leads to constipation. So
Okay.
constipation again causes piles. So you need to
Okay.
avoid multiple cups of coffee or tea.